I'm going to talk about the caregiver voice, and I'm showing a picture of myself and my son from very near the beginning of our journey into learning all about him and parenting a child with some special needs. So this is Alex, but I have an even better picture on this one. This is Alex and my daughter-in-law, Jennifer, on their wedding day. And I'm a very proud mama. Um, I wanted to talk about family-driven care and what that means. Family-driven care is defined by the Substance Abuse and Mental Health Services Administration as a model where families have a primary decision-making role in their children's care and in the policies that govern care for all children in their community. And this means that families are empowered to choose services, to set goals, to design programs, to monitor outcomes, and to partner in funding decisions to support the mental health and well-being of all children. So not just our own personal children, but all children in our community, in our state, and in our nation. So why is there a need for caregiver voice? This picture shows some of my team from Greenleaf Family Center. So these are some parents that work as parent peer supporters in the state of Ohio. And we would tell you that there are some complex challenges going on. Families navigate a lot of complex issues, systems that we don't understand, and that system navigation is a burden to us. It often falls on us to become case managers for our kids. And trying to coordinate that, if it's not something that you've ever done, can feel like a full-time job sometimes. And there's power in our lived experience, so our perspectives are essential for effective family-centered and compassionate care. Um, and our goal really is to ensure the unique needs and experiences of caregivers are driving policy and practice in Ohio. So this isn't just about, again, just for our kids. That's how it started. I spoke up for Alex. I spoke up for what he needed. I refused to let people just do it the way they wanted. I insisted that they had to listen to what I had to say and they had to see how my son could benefit from the way that I thought it needed to happen. But along the way, I realized that this is what needs to happen for all kids. This is really what all kiddos need. And how can I make a difference, not just for my kid, but for the kids coming up behind him? So there are benefits to the caregiver voice. Family voice is really crucial for children with behavioral health needs because we are the constant long-term presence in a child's life, and we have some unique insights, and our active involvement really does lead to better outcomes for our kids. We have a holistic understanding. We have an intimate perspective on what our kids' behaviors are, their triggers, their strengths, their preferences. And this knowledge is really it's invaluable to providers. You're supposed to be developing an individualized plan of some sort, a treatment plan, an education plan, a whatever plan. You need our input. You need our expertise as the experts on our child to kind of put in put a plan in place that really is going to meet our child's needs. Um, Consistency and reinforcement. I can remember arguing with people that I need to understand how this works because I need to do this at home and I don't really understand it. So you need to train me and teach me because when we're involved in the planning and the process, we can implement the skills, we can reinforce the skills. We can help our kids to generalize these skills across all environments that they're part of. And of course, the best piece to all of this is that we have improved treatment outcomes. Um, Research shows that we get a better outcome, whether it's, less hospitalizations, less involvement with juvenile justice, better regulation skills, whatever it is. Our kids definitely have improved outcomes from our involvement. enhanced emotional support and resilience. A supportive family environment fosters a sense of security, of belonging, of self-worth. This can significantly buffer against stress, anxiety, and depression, and it builds resilience. And we talk all the time about kids being resilient and families being resilient. Um, and I believe that. And I want every provider working with families to believe that and to be able to see it firsthand. But so many of our families and so many of our children feel like they don't belong or that they don't have any self-worth, or the stress and anxiety that they're living through kind of takes away their security. And you'll hear from a lot of families that they really value having a place where they have a sanctuary, a place where they feel safe. Sometimes that's their home, sometimes it's a person. But we need to give kids and families what they need. We also can have that early detection of issues. We're the first to notice changes in mood or behavior that could signal a potential crisis or an issue coming up. I know that I had a calendar and I used to log Alex's mood and how he was eating and some of the behaviors that I knew were red flags to the start of something not going well for us. And I would rate them on the calendar. I just had 5 things that I looked at and I would put a number and I would just list them because once I started seeing the little connections, I would let the doctor know, oh my goodness, I think something's going on. And that might mean that we needed to look at an increase in his medication because, as many of you know, as soon as you get them stable, they have a growth spurt or their hormones change because they're going through puberty and then everything is all thrown off again. And so I felt like I was constantly on alert for, those particular things. And for my son, it was the way he ate would change, the way he would sleep would change. Um, he would become resistant to self-care, so he didn't want to brush his teeth, take a shower. So I would kind of, like I said, kind of monitor those and let somebody know, like, hey, wait a minute, there's a problem here. Help us. And I think at first some people thought, oh, this lady is a little type A personality here and maybe a little crazy with the way she's monitoring this, and maybe she's creating some of these um, behaviors because of the way she's acting. But I will tell you that once my team got past that and they saw, oh, she really does have this good information and she can clearly see when things are starting to go off track and we can jump in and stop that from happening, which meant we were stopping my son from, having self-injurious behavior. We were stopping him from having aggressive verbal and physical aggression towards people. There were lots and lots of things good that could come from us, uh, that early detection. Empowerment and reduced stigma. Engaging families in the process provides them with knowledge and skills to manage challenges and to advocate effectively for their child's needs. And this empowerment helps reduce the stigma that surrounds behavioral health and that can alleviate the burden and stress that's experienced by caregivers. The stigma is real. We'd like to think it doesn't exist or that we've busted it and it's gone, but it's there. And empowering families can help to help them to become stigma busters, I guess. It's a lot to carry. The stress is real, and families need to be empowered so that they feel like they're making a difference in the care of their children. And then, of course, system level improvements, incorporating family feedback helps to improve the system for all kids. And I don't know a system that couldn't benefit from some additional feedback that could maybe make some tweaks to better serve families. Um, so I'm happy to say that there are some state programs and some policy integration that is happening in Ohio currently. So there is Ohio Rise. Um, And you can become a member of their family advisory council that they've put in place to hear the parent voice. If you're a member of Ohio Rise and you have a child involved, you have a voice. They want to give families voice and choice. The Ohio Family and Children First is a cabinet that coordinates multiple state agencies, and caregivers sit on every council in every county in Ohio. The Department of Children and Youth have parent and youth ambassadors, and the Ohio Department of Education has parent mentors to help families navigate the educational system. So that's just a few places where we've seen some policy integration take place, and we actually have it written in that parents need to be involved. We have family-run organizations, and here's another picture of some of my wonderful team. This was at the Resiliency Ring that NAMI Ohio put on this last May, and we got to attend it in Columbus. And being part of something bigger than yourself really can be empowering and let you know that you're not alone when you're a parent, and it can elevate your voice. And so, one of our members here in the black t-shirt that says Resilient, Marty, she got to share her story during the Resiliency Ring and talk about her journey of finding her voice and advocating for the children in her life. There's the Arc of Ohio. They have advocates for disability rights. Family Voices of Ohio. This is a family-led nonprofit organization that focuses on transforming the systems of care for all children that have special health care needs, and that includes behavioral health. Connecting for Kids is a family-run organization in Northeast Ohio that provides resources, support, excuse me, and a community for families. So they have in-person and virtual meetings and meetups so that families can support each other. And these organizations really empower and offer that critical peer-to-peer support, education, and advocacy to help families effectively navigate and improve the behavioral health system. Again, not just for their children, but for all children. And how do caregivers elevate their voice? We can participate in care planning, which might mean directly in the care planning for our own child, but it could also mean in care planning, planning for what activities in your community or within a social service organization or in a school, what that looks like. We can connect with others. We can join or start support groups. Parents have a unique knack of finding the other parents that are like them. So whether that would be, families of special needs kids finding each other, families of kids with behavioral health, mental health issues finding each other, parents with kids that are involved in sports finding each other, or families that are really interested in whatever it is. We have a way of finding each other, go to schools, other community events, and we kind of gravitate towards each other. We can contact local and state representatives and organizations. You can reach out to your local Family and Children First Council or your Department of Children and Youth, the Ohio Rise, government representatives. You see a picture here of me with some child and adolescent psychiatrists at the ACAP Advocacy Day in Washington, D.C. a year ago, May. We were there making visits on Capitol Hill to kind of share our story and talk about things that were important to us. ACAP always invites parents to attend, and they pay the way for them to be part of that. I've had the pleasure of attending probably about 12 times in the last 18 years. I think 8 of those times Alex got to go with me. And walking into a representative's office in Washington, D.C. with a youth who wants to talk about what works for them gets their attention. And having the same youth come repeatedly, they remember him. So, they wanted to know, hey, Alex, how are you? How did your baseball season go? Or Did you make the high school team? Or, are you playing travel ball this year? And so it was really a unique opportunity for caregivers to have their voice heard and for youth as well. We can attend meetings, participate in local town halls, advisory councils, focus groups, and any events that are hosted by agencies and organizations that are serving youth and families. We should be there. Even if we're not invited, we should go. That's my philosophy. But we should certainly be invited to have a seat at the table. We can sit on boards and committees, and we can be the voice for all caregivers at various agencies and organizations. Think places like NAMI, our local Alcohol, Drug, and Mental Health Services Board, our Department of Developmental Disabilities. And we can also become family peer supporters. There are paid positions to support and empower caregivers on their journey, and it's now a Medicaid billable service in Ohio. So, family peer supporters are individuals with lived experience as the primary caregiver of someone that's facing behavioral health challenges. They must have navigated a complex service system for at least 1 year. And our purpose really is to use our personal lived experience to support other families to promote recovery and resiliency and wellness. We focus on system navigation, so we get to walk alongside families and support them. And this is a picture again of some of my team. I had found these posters that say "Your voice matters" at my local store, and I was like, oh, I have to buy these for my team. We know probably better than anybody how much our voice matters. And I wanted to get a picture, and I'm so glad I did because I could use it in this presentation. So, what can you do as a provider? You can provide a judgment-free, shame-free, blame-free organization. You can recognize the parent as the expert. You can listen to what caregivers have to say, and you can validate our feelings, meet caregivers where they're at, model these beliefs and ideas to other providers, partner with parents and share the responsibility, model respect in your relationship with the family for other providers and other agencies to see, provide opportunities for caregiver feedback, create formal paid positions for caregivers to inform the system. So it may mean a formal position such as, sitting on a board or sitting in a focus group or creating focus groups or quarterly listening sessions or whatever. But be a champion for the caregiver voice. And now I want to spend about 5 minutes letting Shannon share a little bit about her story and her family. And I want to thank you. And I think I have to stop sharing so that I can see her. Shannon, take it away.
Take it away. Hi, um, I'm Shannon. I have 5 children, three biologically my own, two are my grandchildren that I'm currently raising. And I really got lucky and I met and was referred to a parent advocate. I didn't even know such a thing had existed. But it was really a major thing in my life because I didn't come from a place that I had that kind of support without judgment and bias. And I didn't have someone empowering my voice and showing me that it mattered. And so as I began my journey with my advocate, I began to realize that my voice had power. What I knew about my children was important. And while I may not have carried credentials and wore suits and sat in an office, that my participation in procedures and systems and what was going on really mattered. And when I advocated, I was able to affect change, not only for my children, but through that advocacy, I was able to also learn that I was able to affect change for others. And that was a really great feeling because it's really hard to, as a parent that struggled, to see others struggling too, to see others that deserve more or better than what they are currently experiencing. and to also feel that their voices need to be heard and have value. So as I journeyed along and I was able to make changes with my own children, I realized that I could help others. And so I started networking with parents. I'm not a very social being. So that was a little something out of my comfort zone, but able to do it and was able to create change for others, such as uh, cheer teams, social groups, nonprofits, parades, attending meetings with other parents, helping them navigate systems. Suddenly, people were reaching out to me and asking me, "Hey, do you know about this? Can you help me with this? Can you go here with me with this?" And that was great to know that I had that kind of power and ability to do that, and that I deserved to have my voice heard. I deserved respect from others, and that everybody just deserves support. I'm a firm believer in it takes a village. And I know Marjorie wasn't the only one who helped me along my journey. I had some great SSAs that helped me. I've had some interaction with court systems, juvenile, probate, domestic, that I've been able to successfully navigate without an attorney. So I just really feel empowered that I can take on a lot of situations and help others. And it just starts with being seen and heard and valued, to have parents, other professionals respect my role as a parent and as an expert, that I have that lived experience, that I know my child better than anybody else, and that if I don't care enough and if I'm not invested enough, that others are also not going to be invested enough. So it's my job as a parent to make sure that you're as invested as you can be as a professional in my children's need or process. And so that's just a little bit of my journey. I've really enjoyed it. I'm now a family peer supporter. I prefer parent advocate. But it's a great joy to give back what was given to me, what I was able to experience when others helped me, supported me, empowered me, educated me, and told me that I had value. Another thing is a lot of families have generational curses. They don't come from places where people tell them, you're doing a great job. These new ideas are wonderful. They're progressive. Instead, some people are like, oh, that's, just a bunch of hooey, and that's not really true. And you're just giving people free passes, and places where you don't get to speak about what's happened to you and what you've experienced in life. So, I would advocate for others to hear parents, to value them, to see them, to know that their personal journeys impact their children's personal stories and journeys, and that it's a really the whole family approach has been very beneficial in my life and in helping others. And that's just what I try to do and give to others, what was given to me. So
Perfect.
it
Shannon,
starts
I'm,
with a
I'm gonna
seed.
I'm gonna have